extreme, and then there will be that need for you to, you know, seek medical attention. Sometimes we have to wait until it's at a moment of stress. If not stress, then at a moment of depression. But then Daktari says it has to be looked into at a very early stage. And the pressures of life would justify for us to be anxious, for us to be stressed out, for us to be nervous, for us to be, you know, uneasy. Daktari, what do you make of, you know, this thing that we call anxiety disorder, and to what level then does it become an extreme disorder?
Yes. Thank you so much, Linda. Thank you for having me. As you said, I like the point you started with, that occasional anxiety is very normal in our day-to-day activities. It's actually healthy sometimes to propel you to achieve certain goals. But now when we're talking about anxiety disorders, we mean patients who get preoccupied with this intense, excessive and persistent feelings of worry and fear about certain situations or everyday activities. Yeah, when it gets out of hand, when you feel like the anxiety is so much that you cannot control it, it affects your quality of life, and whatever you do on a day-to-day basis, then that qualifies to be an anxiety disorder.
So that's the best way we can define it, or perhaps do we even look at the aspect of durations? Do we look at more than just that extreme anxiety?
Exactly. So when we come to the different types of anxiety disorders, because it's not just a block, there are different types of anxiety disorders. That's where the duration comes in. There are some like what we call generalized anxiety disorder, where for it to be diagnosed as generalized anxiety disorder, it has to be for a 6 month period. Your symptoms have to have been there for 6 months. We have so many types of anxiety disorders. The duration is there, but that one we won't delve into it. That comes in when now you go to your psychiatrist, when they do what we call clocking, and then they get to determine the period, the symptoms, and they can categorize you as a patient with anxiety disorder.
Perhaps to look at the causes. You say that at least for as long as you are under the sun, the pressures of life will always be there.
Yes.
So to what point does it then, you know, push us to that extreme level, to a point where then we can say this is anxiety disorder? Because it is in order for you to have pressures of life, so that, like you rightfully put it, you know, you can achieve certain goals.
Yes.
But what are some of these notable signs, causes, that would get you to this level of disorder?
Yes, thank you, Linda. So there are very many causes of anxiety. We can broadly categorize them into genetic causes and environmental factors. Genetic is self-explanatory. You're genetically predisposed to getting anxiety disorders. When we come to environmental factors, we have, just to name a few, things like trauma. You find like maybe in children who have experienced trauma earlier on in life, in their childhood, things like abuse, such children develop into adulthood having anxiety disorders. We have things like also substance abuse, like people who misuse alcohol, drugs like marijuana. They can get what we call substance-induced anxiety disorders. We also have physical illness, actual physical illnesses that cause you to have the anxiety. Mostly like endocrine disorders like hyperthyroidism can make you have symptoms like anxiety, or actually the anxiety itself, just to mention a few. We also have just as we've said, stressors in life, general stressors in life. Maybe at your workplace you have too much pressure, you have goals and targets to meet, and then with time it builds up that it becomes now an anxiety disorder. You can't control it, as opposed to being able to meet your targets or your goals. You now develop anxiety such that you're not even able to achieve your goals. Just to mention a few.
All right, so the signs and the symptoms, other than you know, that feeling of worry, and now this should be of course on the person who's being affected, that aspect of being uneasy, that aspect of being nervous and all that. What are some of the notable signs and symptoms that even you as a doctor from the other side would say, you know, I diagnose this, or you know, even like for instance, you see if it's happening to a child, sometimes they might not even know, but from the other side as a parent, you're able to say that there's a problem, this one requires medical attention, this one would require counseling and beyond. So what are some of the notable signs and symptoms?
So I like to categorize them broadly into 3 categories. Physical symptoms, then we have what we call cognitive signs and symptoms, then behavioral symptoms. For the physical symptoms, it's what you can see. You don't really have to be a doctor to know that this person, there's something happening. Maybe you won't know it's anxiety, but you'll see there's something wrong. So for the physical disorders, signs and symptoms, we have things like rapid heart rate. We have things like hyperventilation. I'm sure you've seen someone who has, maybe they're having a panic attack, they have hyperventilation. Patient will come with excessive trembling, shaking, sweating, especially of the palms. You'll have someone who has persistent headaches. You'll get gastrointestinal disorders, and generally a patient who is preoccupied with excessive feelings of impending doom that, as we said, you're not able to control within yourself. And then we have the cognitive signs and symptoms, whereby, as we've said, the anxiety becomes so much, it really preoccupies you that you're not able to think properly, you're not able to function. You get what we call like almost a thought block. You're not able to process thoughts, you're not able to function. Those are the cognitive signs and symptoms. And then in terms of now behavioral signs and symptoms, we have patients who resort to now things like substance abuse. You find someone who is maybe an alcoholic because now they're extremely anxious, they don't know how to handle it, so they resort to substance abuse. Others who resort to possessive behaviors, certain weird kind of behaviors, just to try and cope with that anxiety. Yes.
All right. And so at what point then do you get to see the doctor? Because I'm assuming that out of this, then a lot of things that would happen in your life. For instance, if you get now to substance abuse, then if you are to seek attention, if you had to seek help, sometimes you even got confused as to whether then it's a doctor you see, or you get to see a counselor, a psychologist, or you go to the rehab. There's that confusion therein. So at what point, at what stage do you say then this, I think I need help?
Exactly. So when you realize, at the point where you realize this anxiety is too much, as you said in the beginning, occasional anxiety is normal as part of day-to-day activities. But when you feel like your anxiety is too much, you now cannot be able to function. You're not able to concentrate. If maybe you're at work, you're not able to execute your duties properly. If you're a student, like with the young teenagers, you're not able to focus in school. Your grades are going down. It has really gotten over you, that at that point you really need to see a doctor. Also with adults in our age, where you find that maybe sometimes you can be suspicious that maybe this anxiety is as a result of another physical illness, as we've mentioned in the causes. It can be maybe because of things like hyperthyroidism, heart diseases, diabetes. So once you have that suspicion that maybe there's something else that could be going on, at that point you need to see a doctor. Of course, also we say that, as you said, if you see yourself resorting to substance abuse to really calm your nerves, you're getting so anxious that you have to take like a glass of alcohol every day to make yourself function properly, at that point then now you need to see a doctor. Also, it doesn't have to be the patient alone seeing the signs and symptoms and saying, nice, I need to see a doctor. Even the people around them. If you see someone, this one has to take alcohol to function properly, this one is gets panic attacks all the time, then at that point you need to see a doctor. And most importantly, if you find yourself getting preoccupied with suicidal thoughts, because as we'll mention later, anxiety usually can coexist with other mental disorders, mostly depression. So when you find yourself being preoccupied with thoughts of like ending your life, you feel like, okay, this life is not worth living, so what we call suicidal thoughts, then at that point you really need to go and see your doctor.
Does that then fall under, of course, the risk factors and what and some of the complications, and how then one is supposed to deal with them? Exactly.
That's a complication. It's a cause, it's a complication, it's a point where you should go to see a doctor. All these factors are all intertwined together.
All right. So at this point, is there an aspect of treatment then that would be there for someone to reverse this, and especially for those ones that perhaps could have gone through this whole season and all this process thinking that this is just usual anxiety because of the troubles of life, and now it gets to a level that is critical?
So for treatment for anxiety, there are two major categories for treatment. We have psychotherapy, or what is commonly referred to as talk therapy, and then we have pharmacological therapy. So in a nutshell, for talk therapy, that is the psychotherapy, we have things like the cognitive behavioral therapy. Basically, you get to sit with your psychiatrist. They get to understand what is it that is going on. They do what we call the clerking. What are your symptoms? How long has it been there? And then you get to having that diagnosis of anxiety disorder. And basically, like getting support groups, just learning to control your thoughts and your moods and your behaviors. That's what we call psychotherapy. And then, of course, now pharmacological therapy, that one is self-explanatory, where now you have to take medication. Mostly we have what we call SSRIs, that's the selective serotonin reuptake inhibitors, that's medical jargon. But yeah, those ones are the mostly used drugs. Of course, some doctors also use what we call benzodiazepines, although they're not recommended for long-term use of anxiety disorders.
Okay.
Yeah.
And you speak of long-term. Are there instances that then the treatment would work in totality, that the whole thing is reversed? past, and perhaps you are even taught of ways of managing, you know, your levels of anxiety, or this then results to a point where you just always have to manage?
Well, it depends. I don't like putting finality to the treatment for patients, because it depends as per the patient. You know, there are patients who really, they're actually aware they have a problem, they bring themselves to hospital, they know they have anxiety and they're willing to take treatment. Others, maybe they're in denial, and you know, it's very hard to treat a patient who's in denial. But of course, once you get help early enough, and as a patient, you're already, you've accepted I have a problem and you're willing to have therapy, and you follow your sessions, if you're on medication, you're adherent to your medication, of course it can get to a point where it's controlled and you can function as a normal human being. Yeah, there's no totality of saying this one maybe won't work or this one will work. It just depends on the individual, but yes, it's manageable. It's a manageable condition.
And equally, you know, managing this at home, managing your lifestyle, you know, looking at the home remedies would be very, very important at this point. Just how different is it? Yeah.
So in terms of home remedies, I usually like encouraging my patients a lot, because you find some people have maybe mild anxiety attacks. So I usually encourage my patients things like physical exercise. I'm very passionate about that. Physical exercise, I tell my patients, try to stay active, try to get a routine, like maybe 5 days a week you have an exercise routine. Maybe you run, you cycle, or you do indoor aerobics. That really helps to actually clear up the anxiety or help it get better. I also encourage patients, like since we are talking about alcohol and substance abuse being a cause and a risk factor of anxiety, to try and just stay away from substance abuse, to alcohol, smoking, also caffeinated beverages like tea and coffee. They really actually work someone up and can make the anxiety to become worse. Yeah, so in terms of home remedies, yeah, you can also talk of things like relaxation techniques like yoga, you know, those meditation. They can really help as well. Of course, with like in the workplace, someone who has developed anxiety as a result of stress at the workplace, we encourage such people to make sure you just get enough sleep. When it's time to sleep, just sleep. Don't be on your phone until midnight. Just if it's time to sleep, make sure you get your adequate 8 hours of sleep per day. It can really go a long way in helping alleviate those symptoms of anxiety.
Yes, and before we close it, of course, when we're talking about home remedies, very important that the people around you and even at workplaces would understand that. Are there instances where it would be necessary for you to as well, even just, you know, get the people knowing that, well, this is what you're going through, and perhaps you would require peace of mind that, you know, they are instrumental in according?
Yeah, so for home remedies, you're asking if there's a way people can know.
How then does the society, the people around you come in to make sure that they help you manage?
Exactly, in terms of social support. Social support is very important. If anyone you know, maybe a loved one, a family member is going through it, what we've talked about, the signs and symptoms, there are things you can easily recognize. You don't have to be a doctor. So once you see someone going through that, encourage them, you know, help them do things like keeping a journal and knowing that these are my triggers. Maybe there are people who, when they have what we call social anxiety, when they go to social places, try and support them, you know, because you know in such situations they feel helpless, and that can trigger an anxiety attack. So you can support them in such ways. You can also join your family member or your loved one in going for those jogging activities, cycling, just to give them that support, you know. And also in terms of diet is very important. Just making sure you eat healthy, you eat your fruits, you take your fluids, you take your vegetables, and just eating healthy. It needs a lot of psychosocial support, of course. And then when it gets to a point when it's now a full-blown anxiety disorder and maybe someone does not want to accept, then you can also step in as a family or friends or siblings to actually get a doctor to review your family member to get help. Oh,
good. Fair enough. And time is not on our side. But then again, you're parting shots. Your parting shots.
My parting shots, as I said in the beginning, occasional anxiety is good in life. It can propel you to do better, to be a better person. But once you find yourself getting preoccupied with these feelings of anxiety, you can't function, you're really struggling to contain those anxiety attacks. Please see your doctor. Doctors are very friendly. Make your doctor your friend. Go and seek help. It's not a death sentence. It's not something like, it shouldn't be stigmatized. Anxiety disorders shouldn't be stigmatized. You can be be assisted if you have that, and yeah, your quality of life can improve.
All right, well, fair enough. Thank you so much, Dr. Lydia, for speaking to us. The conversation about anxiety disorder, and as Dr. would rightfully put it, kidogo kidogo is fair enough for you to manage and, you know, just achieve some goals in life. But when it gets to that extreme level, it would be very, very important that you seek advice. All right.